Hey there, it's Dr. Jim. Thank you for coming back for some more information. I'm all comfy and cozy here with my big David Bowie mug of coffee. A Hawaiian blend. Fantastic. So that's not what you came here for. What you came here for was for me to talk about something hopefully of interest to you. My topic today for the video and the article, Parkinson's disease and pain management. Quality of life for a lot of people with Parkinson's disease can be affected more by the non-motor symptoms like pain and depression, more so than the motor, the shaking and the shuffling and so on and so forth. Those are called the motor symptoms, movement symptoms, which are commonly associated with Parkinson's disease. By far, the most frequent complaint of individuals with Parkinson's is what? What do you think? It's pain. Pain that affects roughly between 70 to 95% of all individuals diagnosed with this neurodegenerative condition. Despite this is interesting, non-motor symptoms are frequently unreported to healthcare professionals, and they go largely untreated, which is not good. This brief video, an article, if that's what you prefer, examine different types of pain associated with Parkinson's, as well as a variety of treatments. So let's talk about types of pain. Addressing the issue of pain in Parkinson's is not easy. It's not an easy task. I went through article after article after article, getting headaches and eye strain and highlighting and going back to get it right. Why? Pain is a multifactorial condition in nature. The etiology of pain is difficult to determine. And the symptom presentation of pain is also something that can be confusing. So to make this issue a little clearer, pain can be categorized into different ways. Pain related to the actual disease, Parkinson's, and pain completely unrelated to Parkinson's disease. Let's talk about Parkinson's-related pain first. Pain related to Parkinson's is caused by a degeneration occurring throughout the nervous system as the disease becomes progressively worse over time. In the brain, the basal ganglia's ability to moderate pain becomes disrupted by diminishing dopamine levels. Although, or I should say also, the neurodegeneration process creates spinal oversensitivity, discomfort, leading to pain. That's Parkinson's related. Now let's look at non-Parkinson's related pain. So non-Parkinson's or pain secondary to the disease usually presents as musculoskeletal pain and is many times associated with spine or joint arthritis. I tried to say them all at the same time. So this type of pain is usually amplified by akinesia or the loss of involuntary movement and rigidity that follows. Other symptoms include muscle tenderness, arthritic changes, imbalanced gait, and postural abnormalities. Besides these types of generalized categories of pain that occur with Parkinson's, other types including neuropathic, dystonic, and central pain may also be a part of the clinical picture. And some individuals may also experience oral or genital pain as the disease progresses. All of these types of pain, not good, not fun, all leading to diminished quality of living. There are pharmacological treatments, there are drugs, there are prescriptions. So as with most conditions, the earlier the diagnosis, the better. Start treatment, hopefully get better outcomes and better symptom management. Despite pain being a major factor in diminishing quality of life, only 50% of people with Parkinson's actually receive some type of pain therapy. That's fascinating. Some commonly prescribed pain medications include cephinamide, pregabalin lyrica. I know we know that one. Lyrica, Elavil, Botox, believe it or not. Neurontin, opioids, NSAIDs, non-steroidal anti-inflammatory drugs, antidepressants, anxiolytics, anticonvulsants, and cannabinoids like CBD and THC. There are some non-pharmacological, I always have to put that in there to be fair, non-pharmacological approaches to pain management. So besides meds, people experiencing pain related or secondary to Parkinson's can find relief by using a combination of multimodal therapies like acupuncture, exercise, yoga, meditation, cranial electrotherapy stimulation or CES, physical therapy, or chiropractic medicine. They can all be beneficial to some degree. For more severe forms of pain and later in the disease trajectory, though, more invasive treatments may be necessary for more severely disabled individuals and may involve deep brain stimulation and surgical procedures involving joints and the spine. For instance, using image-guided spinal injections. Now, here's some special concerns that I found, and I'm going to wrap this up. Parkinson's is Parkinson's. With the degeneration and over time, it causes a lot of different symptoms and obviously pain. Here are two other things that we must think about that are very, very well documented and associated with Parkinson's over time: depression and restless leg syndrome. So let's not forget that these might be a part of the individual's clinical picture. So there you have it, another video, another article from me, Dr. Jim. I'm always doing research. So some final thoughts. Parkinson's is the second most commonly diagnosed neurodegenerative disorder in the United States, secondary to Alzheimer's. So we're diagnosing it more. Yes, it might be environmentally induced. Yes, it might be associated with chemicals that we use. And those are all fascinating things to look into. Regardless, once an individual's diagnosed with it, hopefully a quick diagnosis and treatments, medications, and other things to address symptoms like pain, depression, and restless leg syndrome. So keep coming back because I'm not stopping my research or talking anytime soon. Take care. Thank you so much for taking some time to watch the video. I appreciate it. And if you're a licensed healthcare professional who's looking for some great continuing education, we've got it. And we are always working on brand new, fresh content for you. So you can find the link to the website in the description and keep coming back for more information. I hope to see you soon.